Hello, I'm Dr. Schmitz, and I'm a specialty dermatologist, and today I'm going to explain to you what is Aesthefill. So Aesthefill is the more modern of a family of treatments called biostimulators. And what biostimulators can do for your skin? Different from treatments like Botox or fillers, Aesthefill is a treatment that will make your own collagen grow and give you effects linked to firmness, and if you wish, maybe even build volume. But where it really shines is making your skin to rejuvenate from inside. When you think about aesthetics, we have a trio of treatments that everybody likes, which is botulinum toxin or fillers to replenish the lost fat. But do we really have something that's efficient for having a lifting, like a facelifting effect? Of course, we don't have a facelifting in a bottle, but right now we have the more efficient method to restore your youth. Now let's talk about the indications of Aesthefill. In a more conventional fashion, we are going to use on the sides of the face or even in some body areas like buttocks, thighs, abdomen, and even your elbows and your knees to firm those areas. We can also use this as a volumizer. If you need to restore a lost fat from a patient who loses a lot of weight, or if you want even an additional gain on certain areas like the buttock area. And more unconventional uses, which is something I love about it, is that we can use this for treating atrophic scars and even stretch marks and acne atrophic scars, and it works beautifully. So who are the ideal patients for a treatment like this? I think most patients would benefit from this to a certain point, but the patients I see that they are ideal are the patients that are already losing their collagen. So people who lost a lot of weight, or women and men who are approaching their 30s or 40s and they need to restore but without changing. If you're just doing filler all the time, you're just adding volume. But how can you store the elasticity and the quality of your skin? I think those patients are the perfect choice. I'm going to show you how to prepare your Aesthefill. The first thing which is really important is to check if we have all the materials that are necessary. And for the preparation and the reconstitution, we need just a few items. It's a very simple setup, but you're going to see that this is going to make your life much easier. The first thing you need to consider is checking the box to see if we have the seal of safety with the seal that we have from Region Biolab. And after that, we can open the vial and remove from here. There's going to be an extra safety measure right here, which is our aluminum cap. We remove the aluminum cap. There are many ways of diluting Aesthefill. For this particular preparation, I'm going to prepare this with 11 ml of sterilized water. It's very important that sterilized water and not saline due to the nature of suspension and to obtain a product that's more homogeneous. So sterile water. And I'm going to use lidocaine that can be with epinephrine or without epinephrine, whatever makes you more comfortable. I also have a little twist. I like to put a little bit of bicarbonate. If you have ever experienced an injection with sterile water, you might feel a little bit of burning despite the use of lidocaine. So giving a little dash of sodium bicarbonate will make the solution much more tolerable. For the dilution, I'm going to have to work with 3 different methods. The first method is after I do the dilution, I have to shake the bottle for a long time, about 20 to 30 minutes. This process can be replaced by using an orbital shaker, which will do the same as the manual stimulation. So I'm going to show you how to do each one of the steps. The second way of us to promoting the dilution is using what's called a vortex. So a vortex is a machine that we can use to obtain an homogeneous suspension. This is used in several different areas, not just for preparing Aesthefill, but also preparing paints for artistic performance or even preparing lab materials that have to be perfectly homogeneous. And the third way, which is the fastest way, and sometimes a busy office demands that, it's using a 3-way manifold to shake and to twist from 2 different syringes and obtain a quick response for an homogeneous solution. Now let's demonstrate this So I'm going to use 10 ml syringes today for this. And I'm going to aspirate the sterile water. I like to use first a whole vial. So for my dilution today, I'm going to be using D12, which is 11 ml of sterile water, a whole vial. So here now we have 11 ml of sterilized water, and to that I'm going to add 1 more ml of a solution of lidocaine. It can be 1 or 2%, and it can have adrenaline. I like with adrenaline. And for the end, just a little dash of sodium bicarbonate to reduce that burning sensation we have when you're using sterilized water. It's just a dash. Now, I already have my setup vial of Aesthefill. And depending on the outcome that you want to have and depending on the application, the dilution will be different. In this case, I have diluted for 11 ml of sterile water, and I added a little bit of bicarbonate just to reduce that burning sensation from the sterile water, and a little bit of lidocaine with epinephrine. Remembering you cannot use saline for this dilution, otherwise the solution is not going to look good. I have applied a little plaster here just to save proof during the preparation against any spilling of the product. So you have to take attention to that because you don't want to lose your precious liquid gold. Now the first method that we're going to use for preparation, it's like mixing a cocktail. So we're just going to shake it, and we need to do this for a relevant amount of time until the solution is completely homogeneous. That should be something around 20 to 30 minutes. Again, you can use an orbital shaker to do that, and orbital shaker looks very nice on your clinic, so you have the opportunity of grabbing your hands on it. It's going to save you some work, and at the same time it's going to look very nice to have this preparation showing up. Method number 2 of preparation for Aesthefill would be using a vortex. A vortex is a machine that helps to make solutions homogeneous. It's used in the artistry and also preparation of paints and preparation of products that are to be used in the pharmacy industry, and it makes sure that the solution is the more even as possible. We can recommend, if you have a regular vortex, to use this for 20 to 40 minutes. Here I have a high potency vortex, which makes my timing to be much more spared, and I'm going to show you how I can achieve this result. By just applying the vial into the vortex, it starts to mix and creates like a tornado inside, which makes the solution much more homogeneous. Now this is the third method for busy doctors. So we're going to use a connector, which is called a 3-way manifold, and you can also use a fat transfer connector that's going to work the same. So I already have my aspirated product in here, and I'm going to connect it to the 3-way manifold, and I'm going to connect a second syringe of 10 ml. So I have to have room for this. I already have my 2 syringes, and I'm going to start mixing them up, remembering to put the lock pointed outside so you don't have any spilling. And we're going to start to do this process. Slow and gentle, be sure all the connections are very firm. And you're going to do this for 3 to 5 minutes to be sure all the molecules are breaking out and we have the solution to be prepared in the way that we want. It's very important that we have a proper solution to avoid having granules of the product that could cause extra stimulation leading to granulomas. So the preparation is probably the most important step from all your process here. So after you finish this, 3 to 5 minutes, it's ready to be injected. Now our table is ready for injection. So we already have our diluted product in a 10 ml syringe. And here I put a cannula for the infiltration. I'm going to be infiltrating the face. In this case, I choose a 23 by 70 cannula, which allows me to reach most of the areas which I'm treating without needing to make a second or a third entry point. So with this, in most cases, I just need one entry point per side to do a full face treatment. But of course, you can also use a 25 by 50. I would not recommend you to go for 27 or thinner because of the risk of clogging and the risk of perforating arteries and veins. So a safe way to keep this treatment is using a proper size cannula. The second thing that we need, it's a little bit more of anesthesia. In this case, I prefer that you use with epinephrine, and this is going to be for marking the points of anesthesia before preparing the entry point with the cannula. The third thing you need, it's a 20G needle. After you did the points of anesthesia, you're going to need this needle to make your purtoid, your entry point for the cannula, to go smooth into the skin. It's important to have proper hygiene with cleanup product like alcohol or even chlorine-based solutions, and good markers, especially if you're starting with this, to make your treatment plan to be in the proper way. Okay? So it's a very easy setup. Things that everybody can have in a clinic, but we are going to organize this so you make this process to be smooth. I make this treatment in my clinic in 5 to 10 minutes, but I have all the setup ready like this all the time. So one of the indications is producing collagen for skin tightening. And especially a patient like this, you can see we have a beautiful model here, but when we get to our 20s, we start to lose a little of our collagen every year, about 1% every year. With 35, we can recover some of the laxity and the freshness that she had in her early years. So in her case, it would be very interesting to go for the Aesthefill in the lateral side of the face. And why is that? It's because we don't want to create fullness, so we don't want here a filling effect. She does have a good amount of volume, she has a nice contouring to her face, but look how she would look if we could just lift this a little bit. She doesn't need a facelift now, but she could use a freshen up. So for this particular procedure, we want to achieve more lift without volumizing her face. Again, she has a proper contouring of her face, she has a good amount of volume. The first step that we need to take into account is that we need to do our marking on where we're going to inject. We have to find her cheekbone, that's going to be your point. Whatever we do, medial, central to the cheekbone is going to project the face forward. Even if it's not filler, it's a biostimulator, it's going to make her skin thicker and firmer. We will increase the projection if we apply a high amount in here. So our target was going to be treating this area right here, and even within the temple and the parietal area, so we can have a lifting effect from here and from here, like when we plan a plastic surgery. But of course, we are not using any threads, we are not using any sutures. We are just using a pure raw collagen stimulator. Now, over the time, this is going to create a network of soft, very delicate fibers, like a web of rejuvenation that's going to pull up her face, and it's going to improve areas that we didn't even treat, like the center of her face, and we're going to reduce areas like the mentolabial folds and the nasolabial folds just by treating the lateral sides of the face. You know that with any injectables, there are safe zones and critical areas in the skin where you have to be much more aware because of the risk of occlusion, of arterial occlusion. So we are not going to be close to any of these areas today. We're going to be away from the arteries of the face, and we're going to be away from areas like the nose or the glabella, which are the more dangerous areas and needs to have more experience and should be done by advanced practitioners. And this area, we are going to be very, very safe, and it's very unusual to have any complications or even bruising. So once again, we're going to avoid the danger zones today. We have a different goal, so we don't want to go any close to these areas or even close to the glabella. We're going to resume our application on the lateral side of the face and maybe a little on the cheek area. The first step that we need to do is injecting certain points of anesthesia so we can do the points of entry from the cannula. So I'm going to do a little bit of earlobe massage. You hold your breath just a little, and I'm going to inject these points. So I'm doing a little bit of earlobe massage here, just promoting an entry point where my cannula can reach everywhere. And here a second one. So now that we have the entry points to be anesthetized, I'm going to use a 20G needle just to make the entry points for the cannula. So you just flick the skin like this, and it's not even painful anymore. First one is done, and we go for our second one. And from here, we are ready to proceed. A last shaking up, double check for the solution to be homogeneous, check if everything is tight so you don't have any loss of product. A last shaking up, roll it a little bit. If the solution is warmer, it's even more comfortable for the patient, so you can roll up just a little bit before you start your injection. We're going to inject about 5.5 ml per side, again, just a little bit around the cheek area, and from here we're going to go for the lateral part of the face. You can do a little bit of injection while you're progressing with your product. You can do a little bit in the temple as well to firm and lift the corner of the eyes. And inside the parietal area to having an additional lift. And from here, from this entry point, I'm gonna go all the way here. This area can be a little tricky to cross, so don't overdo it, don't try to cross it. We have a ligament right there. So we can stop here and go through our second entry point. I want to stop before the jaw here. I don't want her to grow a jaw. So this side, it's done. Remember, we don't want to be rough. It's important that you go on the subcutaneous fat so the cannula slides without harming the patient. If the skin is really thin or if the patient is already on their last sessions, it might feel a bit more difficult because we already have the network of collagen to be forming. So don't freak out, don't push it hard, just go around those hardened areas so the patient is comfortable during the whole procedure. And again, in this area you have a ligament which is hard to cross, so you need to be careful with that. And that's when you go for your second entry point. And we're done. After you finish, it's important to have a 5 minutes massage on both sides to even out any differences and to use all the tunnels created by the cannula move to make sure we have an homogeneous application. Don't worry if in the first moment you look a little bit swollen or if you have unevenness on both sides of the face. After all, this is not a filler, this is a biostimulator. So over time, everything will be tighter and firmer. So we just finished her procedure and you can notice that immediately it reflects on her face. So she already has this lift. For more that we would love that this is already the permanent and definitive effect, this is more like a Cinderella effect because of the liquid. So it will come down. The difference is that when you're doing Aesthefill, your skin keeps getting better. So it's Cinderella in reverse. You get better and better and better over time.